main blood supply of the cerebellum, superior cerebellar artery, anterior inferior cerebellar artery, and posterior inferior cerebellar artery. Okay, only posterior inferior cerebellar artery is branched from the vertebral. The other two are branches from the cerebellar artery. Okay, that enough for the cerebellum. I want to show you also the location of the cerebellum. Can you see? This is the posterior cranial fossa. Okay, remember, anterior cranial fossa, the medial cranial fossa, and posterior cranial fossa. Okay, this is the this is the petrous part. The petrous part of the temporal bone yang memisahkan medial cranial fossa and posterior cranial fossa. So this is where the location of the cerebellum, like this. Okay, like this. This is the location of the cerebellum. You can see the brainstem akan keluar dekat foramen magnum. So this brainstem, this is the brainstem. Okay, go through the foramen magnum, especially the medulla oblongata. Okay, this is where the lodge of the cerebellum. So we go to the brainstem. Hope we can see the brainstem a bit. Okay. This is brainstem anterior view. Can you see anterior view? But cut into half already at the midline. I'm not sure whether it's been cut or not in the midline. Okay, this is the midbrain. Sorry, midbrain tak nampak. This is the pons and this is the medulla. Midbrain, pons, medulla. This is the area of the fourth ventricle here. We call it rhomboid area. Okay, this is area of the floor. This is the floor of the fourth ventricle. I hope you can see. Okay, pons, medulla, midbrain. Okay, this actually we call it rhomboid. I believe you've been learned in ventricular system for the fourth ventricle. Alright, then I think we go to the dry specimen. Okay, so this is the basilar artery lodged on the basilar groove. This is the basilar groove. Buka je. Boleh buka Izwan Okay. Okay, so this is the medulla oblongata, this is pons, and above it is the midbrain. Can we start with the medulla oblongata first? This is the anterior view. You can see the median sulcus. Anterior median fissure. This is the anterior median fissure, and this is the pyramid. Okay. At the inferior part of the pyramid, suppose ada dia rapat, dia fuse, forming the pyramidal decussation. At the inferior part of the medulla oblongata. Okay, so the pyramid, and then ada fissure. So sebelah dia, we can see the fissure here. This is the anterolateral sulcus. Okay, anterolateral sulcus. What nerve yang ada? Hypoglossal nerve emerge. 12th cranial nerve emerge from the anterolateral sulcus. Okay. Posterior to the anterolateral sulcus, we can see the olive. This is the olive. Okay. Posterior to the olive is the posterolateral sulcus. So apa yang ada kat posterolateral sulcus? Ada the image of the three nerve. 9, 10, 11. Start ke atas is the glossopharyngeal, 10 vagus, the 11 the spinal root of the accessory nerve. 11 cranial nerve, but the spinal root, not the cranial root. Okay. Saya dah buka lah. Okay. Alright. So that is an anterior view. Kita dah pergi lateral view. Then we go to the posterior view. Again, can you see the posterior view? Okay. Posterior, we ada line also. Posterior, median, sulcus. Okay. This is the posterior median sulcus. So ada macam bonjolan. Ada macam bonjolan here. This is the fasciculus gracilis, more medial. Lateral fasciculus cuneatus. Fasciculus gracilis and fasciculus cuneatus. Dekat fasciculus ni, both fasciculus gracilis medial, fasciculus cuneatus lateral. At the most superior of it, fasciculus ni ada bonjolan. Okay, we call it tubercle. Gracilis tubercle and cuneate tubercle. So this tubercle ada nucleus. Nucleus fasciculus and cuneatus nucleus. Okay, enough with the medulla oblongata. Then we go to the pons. Can you see pons? Okay. This is pons. A lot of transverse fiber running. We call it pontine fibers. Okay, this is of all the pontine fibers. Then we go to the lateral. This is the very largest cranial nerve is the trigeminal nerve. Okay, lateral view. Between the pons and medial cerebellar peduncle, as one nerve emerge, we call it fifth cranial nerve, trigeminal nerve. Between the pons and medulla, okay, that's the emerge of the other three nerve. Okay, 6, 7, and 8. Abducen, facial, and also vestibulocochlear nerve between the pons and medulla. Medullary pontoangle. Okay, so fifth cranial nerve, 6, 7, 8. This is pons. We go to the posterior part. Okay. So pons, this is the area of the floor of the fourth ventricle. It's not that clear. So I believe you have been learned ventricular system. You have to know the striae medullaris between the midbrain and pons at the floor of the fourth ventricle. You have to know the vestibular area, vagal trigone, hypoglossal trigone. Okay, that is midbrain. Okay, and then this is the floor of fourth ventricle. Kita panggil rhomboid area. It's the same. Then we go to the midbrain. Okay, so we go to the midbrain. This is the cerebella. This is crus cerebrum. Can you see? Very tight, very thick here. Crus cerebellum. Okay. So crus cerebellum, and then it has superior. Tak nampak Okay. Superior colliculus and inferior colliculus. The superior colliculus connect to the lateral geniculate body by superior brachium. The inferior colliculus connect to the medial geniculate body by the inferior brachium. You cannot see here. Okay. Oh, sorry. This is the anterior view. Okay. Now we go to the posterior view. Okay. Now you can see very clearly superior colliculus and inferior colliculus. Boleh tak? Okay. This is the superior. This is the posterior view. Superior colliculus, inferior colliculus. Sorry, it's not anterior view. It's at the posterior view. Okay. The superior colliculus connect, this is the superior brachium, connect to the lateral geniculate body of the thalamus. The inferior colliculus connect the medial geniculate body via inferior brachium. Okay, so superior colliculus, superior brachium, lateral geniculate body. Inferior colliculus, inferior brachium, medial geniculate body. Okay, you have to appreciate the colliculus. All right. Now, okay, I want to show you the exit nerve root, the exit cranial nerve root. Just the recaps. So this is the olfactory nerve. The first cranial nerve here at the base of the frontal lobe. So it is total. This is entirely sensory nerve. The olfactory nerve. This is the optic nerve. Okay, this one optic nerve. This is a pituitary gland, I think so. Okay, pituitary gland because it's located at the optic chiasma. Okay, so this is the optic nerve. The optic nerve and the optic nerve also purely sensory, second cranial nerve. The optic nerve and olfactory nerve are both emerged from the cerebrum. Okay. The rest of the cranial nerve, the third cranial nerve until 12th cranial nerve is emerged from the brain stem. Okay. So tadi dah cakap, did I show you the third cranial nerve and fourth cranial nerve? Not yet. Okay. The third cranial nerve, I think this one, nampak dalam ni. The third cranial nerve. Wait. Okay. This is the third cranial nerve. Emerged from the midbrain anteriorly, and fourth cranial nerve belakang. Okay, trochlear nerve, purely motor nerve. Here, it emerged here. The only cranial nerve emerged from the posterior part of the brain stem. Okay, so that is the fourth cranial nerve. There are three. Okay. So third cranial nerve, oculomotor nerve, is purely motor but has parasympathetic component. The fourth cranial nerve, yang posterior tadi, is a purely motor. And then fifth cranial nerve, mixed nerve. Okay, trigeminal nerve, mixed nerve, the biggest cranial nerve. Okay, it has no parasympathetic. Sixth cranial nerve. Okay, it's a purely motor. 7 is a mix, and it has parasympathetic also. And 8 cranial nerve is purely sensory. Okay, then 8, this is 9. 9 is glossopharyngeal, is the mixed cranial nerve, and it has the parasympathetic also. 10, mixed cranial nerve also, it has parasympathetic also. 11 is a purely motor. This is 11 that belong to the spinal root. The cranial root is together with the vagus nerve. Okay, this is the spinal root of the accessory nerve. And the 12th hypoglossal nerve is also the purely motor cranial nerve. Right. Okay, I hope you know. Okay, I just want you to, I want to show the important structure.